Good evening, one and all. On behalf of Dr. Agarwal's Institute of Optometry, I extend a warm welcome to each and every one of you for the seventh episode of Optometry Series 2.0. I'm very happy to welcome my team member, Ms. Meenakshi. Hi, Meenakshi. Thank you so much for joining today. And I'm very happy to welcome today's moderator, Mr. Siddharth, sir. Hi, sir. Thank you so much for pitching in today. And the topic for today is conjunctival anatomy. Without further delay, I would like to ask the MC for today, Ms. Rajeswari, to please introduce the moderator.
Good evening, everyone. I am Rajeswari, a third year Bachelor of Optometry student at Dr. Agarwal's Institute of Optometry. It gives me immense pleasure to welcome today's moderator, Mr. Siddharth K. Saara completed his Bachelor of Optometry from the Eyelid School of Optometry and his Master's degree from Manipal Academy of Higher Education. He holds a prestigious fellowship in British Dispensing Optics from the Association of British Dispensing Opticians, London, and is currently pursuing his PhD at Manipal Academy of Higher Education. He has served in multiple roles, including manager, consultant optometrist, project supervisor, and teaching assistant. He has also worked as assistant professor and head of department at Netra Jyoti College of Optometry, Karnataka. Currently, he is serving as a lecturer in Department of Optometry at SRM Institute of Science and Technology, Katanguluthur, Chennai. Sir is the proud recipient of Dr. T.M.A. Pai Scholarship of Manipal Academy of Higher Education in 2019 and has been the Best Original Research Poster Award at the 18th Dr. E.V. Memorial Award at the Scientific Section, Shankara Nethralaya, Chennai. He also emerged as a winner in the Engineering the Eye Hackathon organized by L.V. Prasant Eye Institute, Hyderabad. He has actively participated in numerous screening programs and community eye campus, completed certification courses in data science and research methodology, and has delivered and facilitated several guest lectures. He also has numerous publications to his credit. We are truly honored to have you as today's moderator, sir.
Thank you, Rajesh, for your correction.
Thank you, sir. Now, moving forward with the section, I could like to invite our presenter for today, Miss Priyadharshini, a third year Bachelor of Optometry student from Dr. Agarwal's Institute of Optometry. Miss Priyadharshini, begin your presentation.
Thank you, Rajeswari. Good evening, everyone. I am Priyadharshini, and today I will presenting on conjunctiva, anatomical insight, and common pathologies. We will go through in anatomy, histology, function, and some clinical correlations. Introduction: the conjunctiva is a mucous membrane that protects the soft tissue of the eyelid and orbit, allows extensive movement of the eye, produce the aqueous and mucous components of tears. Embryology. Embryologically, the conjunctiva begins developing around the sixth week of gestation. It arises from suffix ectoderm and its yearly formation is closely linked to development of eyelid and the conjunctiva sac. Development of eyelid, conjunctiva sac, and lacrimal gland. This slide shows the sequential development of the eyelids and the conjunctiva sac. Initially fused, the eyelid later separated to expose the globe, establishing the conjunctiva sac. The lacrimal gland also originates from epithelial buds in the superior fornix. Epithelial bonding. Epithelial bonding from the conjunctiva is the process by which the lacrimal gland and accessory glands from this is critical for tear production and maintaining the ocular surface. Extend. The conjunctiva extends from the ridge margin to the limbus, forming a continuous sac. It covers the posterior surface of the eyelid and reflects onto the eyeball. Pilica semilunaris. Pilica semilunaris is crescent-shaped fold of the conjunctiva at the medial canthus. It allows free movement of the eye and vestigial remnant of the third eyelid seen in animal. Peduncle 4 mm horizontally and 3 to 4 mm vertically, located at the most medial aspects of the intrapalpebral sutures, attached to the medial rectus and moves with the pilica similaris during the globe, composed of the units accessory lacrimal gland tissues, fibroblastics, essentially smooth muscles, fibers, and inclining glands. Palpebral conjunctiva. Palpebral conjunctiva lines the inner surface of the eyelid. It is subdivided into three parts: marginal, dorsal, and orbital, each with different histological features. Marginal conjunctiva extends from the lid margin to 2 mm on the back of the eyelid up to the sulcus subtrossal. The subtrossal groove is situated pa- parallel to eyelid margin. In this region, there is transition from the non-keratinizing satellite epithelium margin to the cuboidal epithelium of the dorsal conjunctiva. Dorsal conjunctiva, thin, transparent, and highly vascular, tightly adherent to the substance of the dorsals to present a smooth surface to the anterior corneal surface. The dorsal pod lies over the dorsal plate and is rich in goblet cells and accessory lacrimal gland, playing a major role in mucin secretion. Orbital pod. This is the loose and highly vascular section of the palpebral conjunctiva fornix, facilitating eyelid movement and floating during blinking. Clinical importance. Common sites for lodgement for foreign bodies, papillae, and follicles are seen bulbar conjunctiva. The bulbar conjunctiva covers the anterior scleral of the limbus. It is thin, loosely attached, and becomes continuous with the corneal epithelium. Clinical importance. It is looseness allows fluid and blood to accumulate easily, which explains why bulbar conjunctiva is often involved in conditions like subconjunctival hemorrhage and phimosis. Fornix. The fornix is transitional fold between cerebral and bulbar conjunctiva. It allows free movement of the globe and acts as a reservoir of tears. Conjunctival sac contains about 7 μl of tear fluid has the capacity of to accommodate fluid to 30 ml. Anatomical feature. Location superior fornix, deeper 14 to 15 mm, formed by elevated palpebral and nullus muscles. Inferior fornix, shallow 10-12 mm, lies between lower lid and globe. Lateral fornix continues with superior inferior. Medial fornix absent due to peduncle and pilica similarity. Structure. It is made up of loose flexible connective tissue. It allows free movement of the globe during blinking and rotation, linked by non-keratinized, lined by non-keratinized stratified columnar epithelium with abundant. The pseudo-satirized columnar epithelium rich in globular cells and the loose containing immune system. Superior fornix. Extended from the upper border of the trochlear plate to abdominally below the superior limbus glands present containing gland of grass. Glands of grass is supported by Lurus muscles. Support structure maintained by fine smooth muscle strips from the levator palpebral superior inserting into the conjunctiva. Inferior fornix. Extend lines from just below the lower trochlear plate to about 8 mm above the inferior limbus. Glands present. It contains gland of glands. Epithelium. Superior fornix 2 to 3 cell layers thick over the trosses. Inferior fornix 4 to 5 cell layers tends to more columnar compared to the cordial epithelium of the palpebral conjunctiva. Keratinization. The surface epithelium becomes keratinized behind the eyelid margin towards the skin. Conjunctival gland. Mucin secretory glands. Goblet cell crypts of Helen, glands of Ness, accessory lacrimal gland, glands of Kirax, glands of Lutring. Goblet cells. It is unicular apicarian types. Secretory cells comprise approximately 5 to 10% of the basal epithelial cell in the conjunctiva. Located in the intranasal bulbar conjunctiva, fornicus and caruncle. Function secrete a gel-forming mucin, essential for lubrication of the ocular surface, tapping debris and pathogens, stabilization of the tear film. Globular cell regulation. This secretion is controlled by neural and hormonal inputs as well as local inflammation reduce goblet cell density in dry eye or ocular surface disorder. Clinical note. A decrease in goblet cells lead to unstable tear film and dry eye symptoms. Thus, there are key in ocular surface disease diagnosis and treatment. Substantia propria. This connective tissues layer lies beneath the conjunctival epithelium consists superficial limboid and deeper fibrosis layers of substantia propria. It is divided into the adenoid lymphoid layer and the fibrous layer. The adenoid layer, the prominent in children and contribute to immune function. Adenoid layers of conjunctiva. The adenoid layers contains lymphocytes, plasma cells, and dendritic cells. It is part of conjunctiva associated lymphoid tissue are called immune reaction. Lymphocytes can be stimulated by viral or cadianal infection or by ataxic reaction to the creatine topical medication to form follicles with reactive germinal centers. Follicles tend to elevate the conjunctival epithelium, producing a round fish egg-like mound. Papillae form from a reactive histamine mediated vascular reaction. Papillae are characterized by chronic inflammatory cells, lymphocytes, and plasma cells, and the presence of center vascular core. Muscular supply. The conjunctiva is richly vascularized. The palpebral portions is supplied by branches of the ophthalmic and facial arteries and the bulbar part by anterior ciliary arteries. Venous drainage. Venous blood drains via the ophthalmic venous. This robust circulation explains why conjunctival inflammation appears so vascular. Subconjunctival infection. Subconjunctival infection involves delivery medication into space between the conjunctiva and sclera, typically in the inferior bulbar conjunctiva. The drug diffuses through the episcleral and conjunctival vessels, allows localized sustained drug delivery to intraocular tissue. Example, anterior chamber. Lymphatic drainage. The lymph from the conjunctiva drains into the preauricular and submandibular lymphatic nodes, which can be palpated in case of severe conjunctivitis. Nerve supply. Sensory innervation comes from branch of the trigeminal nerve. Upper conjunctiva is innervated by ophthalmic division and the lower by the maxillary division. Limbus. Corneoscleral junction. 1.5 to 2 mm wide that encircles the periphery of the cornea. The radius of curvature observably changes at this junction of the cornea and sclera, creating a narrow furrow. The external scleral cursus. Internally, at the juncture, there is large furrow. Their internal scleral cursus. Transversal zone between cornea and conjunctiva and between cornea and sclera. Some layers of the cornea continue into the limbal area and other terminal. Histology. Limbal histology includes basal epithelial cells, melanocytes, and their specialized needs for stem cells supported by vasculature and connective tissue. Limbal blood vessels and lymphatic. The limbal vessels provide nutrition to the peripheral corneal and support system cell function. Any damage there can lead to corneal opacity. Clinical importance. Limbal integrity is critical. Loss of limbal stem cells can result in conjunctivalization in cornea seen in chemical injuries and chronic inflammation. Palisades of wood. Palisades of wood are radial fibrovascularization projection found around the limbal region, especially concentrated at the superior or inferior limbus, appear in a thin grayish ridge or page, each about 0.04 mm wide, arranged in a spoke-like pattern encircling the corneal periphery. Best seen under slit-lamp examination with oblique illumination. Role in stem cell. The palisade house limbal epithelium stem cells responsible for corneal epithelial turnover. Damage to this zone impairs corneal healing. Limbal epithelial stem cell. Limbal epithelium stem cell parasites and division the limbal location. Corneal epithelium stem cells was first described by Dunbar and Evenson in 1971. Corneal epithelium integrity is essential for corneal transparency and diffraction. This epithelial layer is regenerated by a limbal epithelial stem cell population located in the basal cell compartment of the limbus. Characteristics. Limbal stem cells express markers like P63 and ABCG2. They are protected by their microenvironment and supported by limbal fibroblasts. Clinical importance. Loss of these cells result in persistent epithelial defect, vascularization, and vision loss. Early diagnosis and intervention are critical. Common conjunctival disorders. Some common disorders include conjunctivitis, pterygium pendicular, and conjunctival neoplasia. Their diagnosis depend on a sound understanding of conjunctival anatomy. Thank you all for your kind attention.
Thank you so much, Priyadharshini. You almost covered all the categories of conjunctiva. Now I request our moderator to add your valuable input, sir.
Yes, that was a very comprehensive presentation. So, uh, to add on to it, like conjunctiva is often perceived as a very simple and protective covering, you think, but it is in fact complex because beyond its fundamental roles in shielding the soft tissues of the eyeball and face, it is an active participant in the immune surveillance. So that is, and it is a paramount for maintaining the ocular health. So that is the main reason why.
Sir, just a minute. Sorry to interrupt. Your voice is very feeble, sir.
Am I audible now, ma'am?
Yeah, much better.
Okay, sorry. Where was I? So beyond its fundamental roles, it's an active participant. It is very important for. It is very plays a major role in immune surveillance. So that is that explains why conjunctiva often involves in inflammation and infection. Okay, so having this background, understanding its detailed embryology and microscopic structure and neural networks are very important, and these fundamental elements understanding these fundamental elements is would actually help in understanding the diverse pathologies encountered in our clinical practices. So starting with the embryology, the development of as the presenter said, the development of conjunctiva is very interesting. As she said, it originates from two primary embryonic tissues, the surface ectoderm and the neural crust. The surface ectoderm gives rise to the epithelial lining, whereas the neural crust gives rise to the mesenchymal components. Okay, so these formation of conjunctiva is not just an isolated event, but it is coordinated with the development of adjacent structures, including the eyelids and conjunctival sac itself and the lacrimal gland system. Okay, so this, uh, as she had earlier mentioned about the epithelial buds, which is particularly found in the fornix and are very crucial in the formation of the lacrimal glands. These, the complex structure is a very uh, perfect. They are perfectly orchestrated and is precisely regulated by the network of molecular and cellular events involving specific transcription factors and signaling molecules. Okay, so I don't want to mention all those transcription factor and signaling molecules. So it is just like I just want to say it is more like an moderating molecules. We'll just finish off because it's if I start listing them down, it will go as a very big list. So any failure in these developmental processes is something which is going to lead to a wide range and heterogeneous spectrum of congenital malformation, ranging from the isolated anomalies to the components of complex syndromes. So these malformation often depends on the very critical on the timing of the causative events during the development. Okay, so per se, for more severe malformation could involve the eyelid conjunctival fusion, which is the ankyloblepharon, and then another rare but severe condition is the cryptophthalmus, where a sheet of skin would actually extend over the disrupted eyeball with a complete absence of the eyelids. Okay, and another important clinical consideration I would say is the ophthalmic neonatrum, which is more common in the newborns. And like why I want to stress that on here is with anatomy and this thing is because like it is due to it is due to several factors. Okay, so like lack of IgA and decreased immune functions. Okay, so crucially at birth there is an absence of uh, lymphoid tissues in the conjunctiva, which normally develops after 2 to 3 months of the life. This is the and these lymphoids are plays a major role in the uh, immunity, and that's the reason why we get a ophthalmic neonatrum. Okay, so when we speak about the immunity, it's always better to speak about how vascular and lymphatic and nerve supply again goes with, because conjunctiva boosts a rich and intrinsic network of vascular, lymphatic and nerve supplies, which is essential for the function and responsiveness to the diseases. Okay, so as she had already said, palpebral conjunctiva is it receives its main blood supply from the ophthalmic artery, and supplemental blood comes from the facial and superficial temporal and inferiorbital arteries. For the bulbar conjunctiva, it is the branches of uh, anterior ciliary artery, which forms the superficial marginal plexus and peripheral arcades and the palisade of forehead, which she was mentioning about. Okay, and when it comes to the palpebral conjunctiva, it is the post-tarsal veins uh, of the eyelids and the facial branches of the anterior facial vein. Okay, and the pterygoid plexus. When it comes to the bulbar conjunctival veins, the episcleral veins drains into the episcleral plexus, which then empties into the intrascleral plexus. So as she had earlier mentioned, the uh, lymphatic drainage is very important, and then the lymphatic drainage for the conjunctiva joins those with the eyelids. So as she and then she had mentioned how medially it's been drained, and then how laterally it's been drained, so I'm not going to mention about it. And then she had also mentioned that like uh, it is very critical for important in case of tumors. So because any enlargement or enlarge or periauricular or submandibular lymph nodes can directly indicate a conjunctival inflammation or a neoplastic process, guiding us in the diagnosis. Okay, as she had said, it is, yeah, the nerve supply for comes from the trigeminal nerve, and then they have a very rich supply of rich nerve supply, and this extensive innervation contributes to the conjunctival sensitivity to the irritation and the pain, and that's where the reaction, the inflammatory and the infection reaction triggers from. Okay, so when we speak about the inflammation and the infection, it's always good to speak about uh, the drug delivery method for these things. So there are so most effective method I would uh, s- say is the subconjunctival injection. It is more of a targeted delivery method. So it is typically injected in the inferior bulbar conjunctivitis, because these drug diffuse through the episcleral and conjunctival vessels, and it is it helps for the localized and sustained drug delivery to the intraocular tissues, especially when the anterior segment, thereby bypassing any systemic side effects often associated with the oral medications. So these methods uh, are an valuable alternative to any to systemic or topical drops for specific ocular conditions. So though it can't be used for all the ocular conditions. So she had lastly she had also been mentioning about the limbal epithelial stem cells. So like when we speak about the limbal epithelial stem cell, it is there are multiple signaling pathways which are regulating this limbal epithelial stem cells. Okay, so these are the self renewal and differentiation. These signaling pathways are being very tightly regulated by several key factors, and then and these tight regulation include bone morphogenetic protein and any transforming, I mean growth factors as well. So these are the very few factors which I don't want to just mention about. Okay, and because these factors are something which is crucial in the embryonic development. Okay, and these factors, proteins and the factors are something which helps in the homeostasis and the regeneration. That's the reason why I want to just mention about these things. There are multiple signaling pathways or multiple factors which are actually helping with the stem cells. So, and any disruption in these signaling pathways is going to implicate any tumorous growth, and that's the reason it is and these are very important for these molecules are something uh, which they uh, look into when they are studying about the cancer stem cells too. So these that highlights why it is why the balance between these signaling pathways is very important for a proper cellular function. Okay, and there will be multiple crosstalks between these signaling networks, and it is common and important for the a very integrated function of the overall limbal stem cells. So understanding these pathways, if we could understand these pathways, would open avenues for targeted therapies to restore or enhance limbal stem cells function or to prevent their malignant transformation. Okay, so when speaking about the limbal stem cells, it's it, it's good to mention about the stem cell deficiency too. So it is a limbal stem cell deficiency is something which is going to cause both visual and ocular morbidity. Okay, when these stem cells are lost, the corneal epithelium is unable to repair and renew itself, so leading to epithelial breakdown. So uh, so in there is a persistent epithelial deficits, the cornea will get conjunctivized. So it is marked by the presence of glow blood cells on the cornea. So all these factors contributes to the loss of corneal clarity and potentially the loss of vision and chronic pain and photophobia are something which is going to lead follow over one by one. Okay, and this is very important to be diagnosed at as early as possible. Okay, so as I said before, it is when the cornea gets conjunctivized, it is the hallmark clinical sign is the absence of palisade walk, because it is, as she had mentioned, it is a fibrous material where most of the limbal cells are going to be, and that is the transition zone. If that is not there, and when viewing with the slit lamp, if that is not there, that is a clinical sign where we could say that it is cornea is getting conjunctivized. So other than that, there are advanced diagnostic techniques which are again crucial for confirming the staging of limbal stem cell diseases. So one among them is the impression cytology, where it detect where we apply a cellulose acetate paper over the cornea and then collect the cells for histological analysis. So it can detect glow blood cells which are which are, as I said, it is a hallmark for the conjunctivization of the corneal epithelium and can confirm the diagnosis of the limbal stem cell uh, diseases. Okay, another one is the in vivo confocal microscopy. Again, it is a non-invasive imaging technique that provides a high microscopy examination of the microstructures of the cornea, limbus, and the conjunctiva at the cellular level. Okay, so these are the more of a diagnostic techniques. When it comes to the management strategies, so it can be again further divided into both the medical management and the surgical management. So it aims to, well, the medical management is more for the earlier stage, where it aims to restore the limbal microenvironment by stopping the insulting factor per se. If there is it is a contact lens which is causing the insult, we would stop discontinue the contact lens, and then we optimize the ocular surface. When these medical management is not working, we'll move on to the surgical management, which required like which includes options like epithelial removal with or without amniotic membrane, or transplantation, or simple limbal epithelial transplant even works. Okay, so like when it comes to the common diseases, apart from the bacterial, viral, and allergic conjunctivitis and the pterygium, I would also pay attention to the dry eye diseases, and then the Steven Johnson syndrome, then the xerophthalmia. And paying, because dry eye disease is something which is going to which is coming in regularly, and that is more of a multifactorial diseases. So to conclude, it is like understanding the nuances like is of the anatomical structure is not just for the academic purpose. So like because that could really change the give a better idea of the therapeutic strategy for managing the ocular surface disease. And looking ahead, the field of the ocular conjunctiva and ocular surface health continues to evolve, and advanced imaging techniques like the high resolution confocal microscopy promises some deeper and non-invasive cellular imaging techniques. So research into this molecular signaling pathways that governs the limbal stem cell fate actually holds a immense potential for developing targeted therapies to restore or enhance their function, offering new hope for a uh, vision uh, preservation. Okay, so like furthermore, like understanding the ocular immune and these uh, other pathways and the anatomy is going to help you in the will help us in moving towards more personalized medicine approach for the complex diseases. So yeah, that's all. So like think that should, I just want to make it as short, I think this. So let's see.
So thank you so much, sir. You took us very deep into the key aspects of anatomical pathway. It was very nice listening to you, and we are happy to host you in one of our wonderful platforms, sir.
Thank you, ma'am.
Over to Gomati now.
Thank you so much, Meenakshi. That's it. Thank you so much for joining us as today's moderator, sir. Thank you so much.
Thank you, ma'am.
As Meenakshi was telling, we'd like to host you on another wonderful platform, sir.
Thank you, ma'am. Thank you.
Thank you so much. Thank you. And we have a couple of announcements to make. I'll make the announcement now, sir. Yes. Dear audience, thank you all for your continuous support towards Optometry Series. Not only Optometry Series, the case presentations also started to go live on our YouTube channel. So subscribe to our YouTube channel to get notifications on a regular basis. Apart from this, admissions are open at Dr. Agarwal's Institute of Optometry for bachelor's, master's, fellowship, and internship in optometry. And another exciting announcement for this particular week is, in collaboration with the Laylo ICAM Engineering College, we are hosting engineering and optometry in eye care innovation conference in October 24 and 25. Abstracts timeline has been open and it is closing. The deadline is closing on July 15, 2025. So you can start sending your abstracts also. And one important announcement for this particular week for all the students at the campus of Chennai is DIO's Champions League 2025 is now open. So congratulations for all the captains and vice captains. Let the whistle begin. So thank you all so much for your continuous support. We'll meet you in the next episode. Thank you, Siddharth sir.
Bye now.